My name is Selba-Gondoza Luka. I am the Chief Executive Officer of Afri-Aus Care Incorporated in Springvale South, Melbourne. Unfortunately, alcohol is a substance that is legal, and when people take alcohol first time without more education, they don't know that it is a drug of addiction. And when they continue to take, people have lost lives due to addiction, lost jobs, and also family breakups. Alcohol, when taken in moderation, it doesn't affect people's lives much. But when people take it excessively, when it becomes an addiction, then destruction happens in people's lives. When I was growing up in Africa, alcohol was mainly taken by the older generation, people in their late 40s, in their 50s, and they could drink sensibly. But when I came to Australia, I saw, and I continuously seeing that a lot of young people, they get access to alcohol. It's readily available, it's cheap, like you can get 5 liters of wine for $10. And more so, alcohol is used as medication for people self-medicating themselves when they feel anxious and when they feel depressed. And I see that people, they just take alcohol continuously, and it's even impossible to break the cycle unless if they have intervention. Sometimes it requires medical intervention, like people going to detox units or counseling. So the difference is here, alcohol is readily available for young people. The people who are mostly affected by alcohol are the young people. The older generation, it's just a few, especially those people who are going through some trauma or marriage breakup. But alcohol in the young cohort, it's more like peer pressure or just taking as an experiment, or self-medicating themselves if they have some depression and anxiety, as I said before. So it's more prominent in the younger generation. And unfortunately, we see a lot of young people dying prematurely or having alcohol complications like fatty liver. Some, they even have complications with their kidneys. Some young people are kicked out of home and they become homeless. And also, because of the addiction, some of these young people do get in contact with the justice system. That's why you see there's a lot of overrepresentation of young people in jails. In most cases, you see the offenses they caused, they were under the influence, could be under the influence. What needs to be done so that people can actually change is alcohol and other drugs awareness, information sessions, organizations working together. For instance, a community can mobilize community members together, having a focus group, and work with another organization like Secada or Task Force or Monash Health, the organizations that have vast knowledge on what alcohol is. Even getting information on the website of Alcohol Drug Foundation, they do have a lot of resources there whereby people can actually watch videos, they can have the information through pamphlets. What I find it that is more positive, that people can get the information easily, is the focus groups, where people can actually be asked direct questions. The presenter can ask the questions, and also the community can ask questions. Mostly people with lived experiences are the ones who can actually say the challenges they face when they start using alcohol and when they become addicted, and also what happens when they get some change. Not judging people who are going through addiction. When you judge people, of course, they will not come back. They will just continuously drinking. So harm minimization using lived experience stories is one thing that can bring the change. People, they want to change, but sometimes they're a little bit skeptical when they get judged. And when we see that an individual cannot help themselves, it's referring them to other organizations like SECADA, then Community Withdrawal Unit here in the Southeast, where they get support whilst at the unit. Accept them as an individual, understand why they started drinking alcohol, and also being non-judgmental, and getting them to come to a community like here at the community village. Offer them practical groups like the young people we offer here at Afri-Aus Care, Big Connect, Social Night. Allow them to socialize with other young people who have gone through the same. As I did say before, lived experience stories are more powerful because people can know that they are not by themselves. There are other people who also walked the same pathways. And if there is need for medical attention, refer them to the GPs, who would then further refer them to a psychologist for counseling, and if need be, SECADA for assessment, then withdrawal unit or rehabilitation. Continuous support, non-judgmental, and the use of harm minimization. Don't just tell them stop drinking, because it can be dangerous, especially for those who have been drinking for a long time. So you can tell them to minimize the amount of alcohol they are taking, and also eating appropriate food, exercise if need be, yoga. The main thing is to be there for them, because alcohol can kill people if not taken appropriately.